to ask the female history as well, because in the check.
Yes, but in this scenario, it was in more, as I mentioned, you in the construction industry, mostly you'll find male with the mesothelioma.
Okay, so one is that, so if we are suspecting PE, so in PE we have cough with blood.
Yes.
Okay, so we should need to ask about travel and contraceptive pills.
Long flight as well. Long flight as well. Yeah. Pregnancy as well. Pregnancy as well.
Because in real exam we don't know if it's mesothelioma or if it's pulmonary embolism. So we should ask female history at least to rule out.
Yes, exactly. So you need to ask about what type of pain is this, sharp pain or not. In this way, you will go.
Even cough with some blood.
Yes, definitely.
Some traces of blood.
Yeah, in the female history, they will tell you like that way she might be recently pregnant, long flight. If they are going to, there's a high possibilities. The people who's having scenarios and having examined May, there is a high possibility they would add on new scenarios. So just make yourself more about DD that you go, even if you find a new scenario of like P. The P is coming in, used to come in SimMan. They might add up that they are adding more UKML content map things. So we'll come to that as well. So this is about the respiratory medicine. Thank you very much, Ifza. So, yes.
Actually, this came in my exam, and the person was like, the patient was like, he was around 25, 26 years old.
I can't hear you properly. Can you speak a bit louder, please?
Yeah. So this came in my exam, this scenario. And the person was 25, 26 years old, and he has no nothing, no concerns, because it was an accidental finding. They have just given me one page that it's bilateral pleural thickening. And I asked him everything, like the red flags, and he didn't even complain that his friend has something. Nothing was like told, and I have to manage him. So there was just, he said that I don't have any problem. I no loose clothing. I'm eating well. I'm going out. I just fell down, and then they took my chest X-ray, and there they find that I have like this pleural thickening.
Good. So that's a good way that they've given you the X-ray finding. Let me tell you one thing. The construction industry. He was working in construction industry.
Yes, he was.
That's fine. In UK, construction industry, these cases are very common. So if they're given you one finding, not every time they'll give you the similar findings. This is what I'm trying to say. The PLAB-2 is changing. They are changing to give you different findings. But if someone is working in construction industry, having a cough for a long period of time, or he has some finding like incidental finding in the chest X-ray, definitely you will suspect something serious like cancer of lung, because it can have, you need to ask how long he's been working in construction industry. And because if you ruled out TB, if you ruled out pneumonia, no fever, nothing, or the positive finding is directing you toward something like related to the construction industry, definitely at that point, you would suspect mesothelioma. Nazish Khan, you don't need to worry much. So what we are basically doing, we are creating summaries. In our ebook, we are creating, so we are adding all the PLAB-2 scenarios plus. So I want to show you quickly what we are doing. So basically, before break, I'll show you. So if you stay tuned, I'll show you UKML content map and one of the ebook which we have created for CVS. We have put everything, almost everything, which you might have in the MLA type of exam, in which we have added all the presentations. What are the new presentations, and what are the possible presentations, and what are the possible. So in our, let me tell you how we created ebook and what things you will see in that ebook. So today, the cardiovascular ebook, you will see along with the UKML content map possible scenarios. So let me quickly show you. So basically, in that ebook, what you will find out, like this in ebook, you will find what things you will find out. Let me show you. 1 second. So let me see if anybody joined as a simulator as well. Okay, Isha is here. Thank you, Isha, for coming. So we'll be starting. So Isha, what topic we are about to do today?
Rheumatology and hematology.
Rheumatology and hematology. Definitely, you are on the right time. So we do one scenario from rheumatology and one scenario for hematology. First, we'll do hematology.
Okay.
Okay, so in the ebook, what we are created, so let me tell you, so what would be the pattern of all scenarios which we will be doing. So basically, we are doing on that pattern the possible presentation. So UKMLA content map. Let me share that UKMLA content map. If you give me 1 minute, Isha, you have a UKMLA content map. So let me quickly get it download on the UKMLA content. And I'm going to share, then I'll tell you how you will tackle with this UKMLA content map. Just give me 1 second. Let me airdrop. Then I'll show you how we are creating ebook. Because it got a bit delayed, all ebooks was ready, but we are updating it for the content map. We are working hard on that. Okay. So let's say, for example, so in the UKMLA content map, I'm going to quickly download it now. Yes, now done. Yeah, so I'll quickly show you my screen now. Okay. PDF is there. Opening. Yeah, thank you, Hina, for sharing that PDF as well. Let me open this. I think there's some issue with this. Yes, it's open now. Okay, so I'm going to share my screen with you guys, and I'll show you how we are creating our ebook. So you can see that. So how you will find that thing. So you can see this MLA content map. So what we are doing, for example, so how you would see the cardiovascular system. So when you go in this UKMLA content map, they have given you different systems. For example, this is cardiovascular system.